where to start, really. There's a huge amount to cover. And I'm sure that the U-turns this week, there's been a great deal of confusion over VCOD. There's confusion over visiting. There's confusion over forward testing, how it's going to be done, which type, and who's going to pay for it. And, you know, as we get more information, then we will obviously put it on the website, we'll circulate it. I'm aware that there was a meeting yesterday afternoon. Some colleagues met with CQC to see if they could get a defined view on what is happening with regard to the VCOD situation. It is likely to go through, but if it doesn't, what happens with those people who may have been given notice to quit, etc. And indeed those people who may already have been served notice or left. So there are a number of legal opinions. As we believe at the moment, there are no actual definite confirmations. There is a meeting this morning, which obviously we can't attend, and there's a meeting later today. So if we get any more information, then rest assured we will pass that on. There's quite a lot going on, which we will put some leads in the chat as the meeting goes on. And Dudley, a few points from you, and then we'll move on with Denise.
Thank you very much, and everyone, for joining us on the second of this bright, sunny, lovely, loving month. There is, as Peter said, a lot going on, and if you blink, you'll miss it. We don't have to wait for Friday afternoon for the updates. It seems to be every hour that things seem to change. And yeah, we'll throw in a joke. There is no parties here. It's really serious for us in health and social care. A lot of areas to look at, as Peter said. We've got safeguarding, which is really some of the things that we forget about. Is really part and parcel of what we're doing. We've got a lot that's happening at the moment with the visas for overseas workforce. And I think Laura may post some of the Skills for Care doing 2 events that seem to be happening. It seems to be fairly oversubscribed, but there's various pieces of information coming from the Home Office and the DH about what's taking place with that. Other than that, I would say there is no easy way of saying just keep up to date as much as possible and share lots of information with your staff. And it's really about keeping your staff's morale up, and well-being is also really one of the major key factors. That is something that we have to consider because of what's going on, ways of things such as rest, and now hopefully there may be a bit of change with the restrictions and whether trying to look at other things you can do to help the workforce, because especially if we can't increase the pay, we definitely can make the workplace a more, our diverse workplace, a more inclusive in many shapes or form. So please do consider that. Other than that, we will be sharing, if you aren't part of the WhatsApp groups, the information about WhatsApp, and use that platform as well as this platform to share any information, ask questions, to speak with your peers and so forth. So everyone enjoy the meeting, and I'll leave it to some of our wonderful speakers that we have on board. Thank you, Peter.
Thank you, Peter. Obviously, I've shared this with Peter, and we both agreed that, you know, I'm not going to spend lots of time on some of these slides. Some of them I've put in because it's kind of our governance, Safeguarding Adult Board. But I'm Denise Snow. I'm the board manager for Croydon Safeguarding Adults Board. And thank you for inviting me today. I think this is my second time I've come to this forum. So thanks for having me back. And I am not Peter's scary sister-in-law either. So just want to get that confirmed. Right, next slide, please, Peter. Okay, so I'm going to say just some brief stuff about who we are, what we do, because I sometimes think people think because we sit within the council, we are the council and the local authority. We're not, we're independent to the council, so we cover all the partners, health, council and police. So if we just go on, please, Peter. This is basically who we are. Very quickly, won't take me long to get through my team. We have an independent chair who's Annie Callahan, and she's commissioned to do 30 days a year. Okay, that's all we get from the independent chair. And then you've got myself and Leslie, who work as the team to actually support the work of the board. These are our priorities. So prevention, commissioning, making safeguarding personal, quality and improvement. And then we have these cross-cutting themes, which goes across all our work: voice of the people, communication and engagement. And we have 3 statutory functions. One is to produce an annual report, which is public facing, and it will be on the website soon. Develop a strategic plan and commission safeguarding adult reviews. So what I thought I'd do with this presentation is just pick up each one of those points. So can we go to the next one, please? That you will get this in the slides. I am not going to go through this structure, but as you can see, there's not that many groups we've got. When I first joined Croydon in 2017, we had 13 committees sitting under the board, and it was repetitive, work was being duplicated. It really didn't serve the purpose, so we streamlined it. So you can see we don't have 13 groups on that structure chart. Can you go to the next slide, please? Again, these are 6 safeguarding principles. I'm pretty sure you've all seen these, so you'll get this in your slide deck. I think the next slide is the most important one of the types of abuse. And I think we kind of forget these, that it's not just about people in people's care where safeguarding is involved. It's also about people who care for those people. You know, there are, if you go down here, there's lots of different types of abuse. We try to kind of do it in nice, simple, easy language as well, so people can recognize abuse quite easily. And at the moment, I'm working with our Voice of the People subgroup to actually look at this in more detail, but to actually produce a set of resources which are citizen-led. We're working with the BME forum with this, so we've got volunteers to come and sit with our Voice of the People group and go through the best way to get some of this information out to all communities. So it's understood, they know where they can go to, signpost things, you know, in an easy way, and for people to know what pathways to go down. So, you know, we're looking for more volunteers, so I can get something in the chat about that later. Do you want to go on to the next slide, please, Peter? Our duties. It sounds really boring, statutory duty to the board, but they're not actually. If I go on to the next slide, and you'll see why when I get to the 3rd one. They're really essential. This is the cover of our annual report this year. This will be on the website next week with lots of other more information going on, but this one we have to cover. So this week we've just completed, it has to go through the local authority governance. So cabinet, we have to present it at cabinet report and it gets signed off, but it's public facing. It's about telling everybody in the public what we've done, but more importantly, what we need to do and what else needs to do, and how we're going to fill those gaps with some of the priorities we're working with. You know, and I'm really keen to get people's feedback. I've changed this report since I've started. It used to be like an A4 document, lots of narrative. We tried to make it more visual, easy to read, like it's shown on this screen here with the bullet points. Each page of the report covers our priorities. We have people giving us feedback from the community about the services they've experienced with regards to safeguarding. And we use all our partners. So Mind in Croydon, Health Watch, Age UK, all of those actually contribute to this report. And it's just set in a simple format. One side says what we've done. The other side tends to be slightly longer on each page saying what we need to do. So I want it to be a really honest document. So please, when you get the slide deck and you can go onto the website and look at the report, please send me feedback. Really keen to get it. Next one, please, this is the next page is about the strategic plan. This looks a more boring slide. To me, this is my headache, but this is a plan I have to do. It's a 3-year plan saying what I expect the subgroups to deliver and what the partners need to deliver. And it is, and again, will be on the website. So this is my kind of monitoring document to be able to go back to partners and say, but you said we were going to do this. Why are we not doing it? The next one. This has been the Safeguarding Adult Reviews. This, and again, I'm not going to sit and read through all this. I just want to give you some idea of what we do. This is a really important part of our job. I'm not sure how many of you are aware of Safeguarding Adult Reviews. Anyone can put a request in to the board to say, you know, we have a form you need to fill in to say that this happened. It could have been better for that person. Services didn't work together. The person's either come to considerable harm or has died. And we as a committee look at them. We see if they meet the Care Act criteria, you know, of a SAR. So basically, was the person vulnerable? Was the person in receipt of care and support needs? And what agencies were involved? And as I said, could they work better together to have prevented this happening? I wanted to give this example. This report is being signed off. It's going to go on the website this week, along with 3 others we've completed. But this one was more relevant to you because it happened in a provider setting. I just want to say we get very few of those. Okay, most of our Safeguarding Adult Reviews are from either home, hospital, just literally out in the community, and I just want to sort of express that this is such an important piece of work, because it's not just about how sad these cases are, but how do we learn from it? You know, and I get so disappointed if I support a SAR, we get a SAR come through, we see it get signed off, we get the learning from it, and then I receive another request, which is similar themes. The themes we tend to get is around mental health at the moment, suicide really coming through in large numbers. When I joined Croydon in 2017, they'd only completed 1 Safeguarding Adult Review. We're now on our 8th, and the requests just keep coming in each month. You know, so this is, you know, we set them out with, you know, the background of the person involved, and then the key learning. Do you want to go on to the next slide, Peter? So we can see how these pan out. Kind of, and also looking at what has changed since this happened, because sometimes we get these reviews come in and we actually can't start them off yet, because there could be parallel processes going on. So there could be a police investigation, there could be CQC investigation, we could be waiting for a serious incident report from health. So we kind of hold back a little bit and see what comes out of those investigations. So sometimes we pick them up and we've got a year, 2 years maybe passed. So we just like to know what has happened since. One of the key parts of this particular one for KYH was interpreting services. And I don't know what your experience is of this within the provider market, but you know, that was one of the main problems with this case. No one could really understand what KYH was saying, although, you know, the provider tried really hard. You know, there didn't seem to be the services to actually be able to get into to help this gentleman. And then what needs to be done? When it comes on what needs to be done in the lessons learned, once these reports are published, that's not the end of it. That's where the board's job comes in. We need to monitor it. We need to get answers if this work isn't carried forward. And if there are significant themes coming through other Safeguarding Adult Review requests, we go back to those providers and say, you know, this is still happening. Do you want to go on, Peter? I'll leave this for you guys to read and get sort of, because there's lots of information in there. Peter mentioned to me about LPS, Liberty Protection Safeguard, and my kind of heart sunk straight away because this seems to be a continuing saga. So although the board we're not in control of this going on in the council, we need to know what's going on because we need to make sure that the partners are ready. Do you want to go to the next slide, please, Peter? Because when my previous job, I worked for London ADAS, so the Directors of Adult Social Services, and that's quite a long time ago now that we're talking. I started, it would have been at least 8-9 years, and this system was being discussed then and under consultation. So for me, it seems to be that it's been around for some time. I'm assuming you know some of this, but so forgive me if I'm telling you things you already know, but we know that it's been postponed. The difference in this postponement is that we've not been given any commitment to any future implementation dates. We normally get, oh, it's been, April's not going ahead, so we're looking at July or we're looking at next year. This time we've had nothing. Literally no idea of when it's going to be, other than there's going to be the public consultation on the regulations in Code of Practice. The Code of Practice has been the difficult thing in all of this. You know, the local authority or partners have been waiting for this to come out, and obviously it still isn't out. There is going to be this consultation period running, they say it could be 12 or more than 12 weeks, but we don't know when. Okay, but I think the most important thing for me to get across to you today from my colleagues in Croydon is Croydon has actually undertaken a great deal of work. I'm part of their LPS working group, so all the partners are together, so they're doing it for one system. So health and social care working together on this. They did a corporate study, so they're ready for implementation, but it's difficult to prepare for parts of it without a code of practice. So they've kind of been working blind on this, but getting as much done as they possibly can. I spoke to the head of the DOLS team, and for all of you, the providers, you know, they will be providing support and training, just like they did with the DOLS. You know, I don't know how many of you have got connections with the care support team within the council, but that's part of the team who's been working on this. But there has been an important change to note, and that's the role and responsibility for the provider, because they seem to, maybe Dudley mentioned U-turns in the beginning, there seems to be another U-turn on this particular part of the LPS system. So before it was going to move over to the providers to do that initial consultation. Now that's changed. It's gone back to the local authority. Okay. Finally, there's been, and I get them, I get lots of emails coming in about, can we help you with offering training for LPS? Lots of companies seem to be picking up and trying to get sort of business cases through. The local authority wanted me to stress today that although there's many cases from small and large businesses regarding training, they're not going out looking at tendering for systems like this at the moment because we don't have enough information to work with. So I hope that helps. I suspect it doesn't answer all your questions, but to be honest with you, I'm not quite sure who can at the moment, because we're kind of in this limbo, and lots of work has gone into this, but we're still waiting for the system to come into place. And it's frustrating for us, so I dread to think what it's been like for you, and you've had to deal with a pandemic. So I got no other words to say about that. Next slide, please. Just some stuff for you to sort of look through what we're doing, and this is kind of what we're leading on with the board. I've mentioned to you about the Voice of the People subgroup and the citizen led resources. We're going to be running a conference planned on self-neglect. That's actually going to follow a self-neglect audit. So we're going to send out an audit, multi-agency, across the partnership. We pick out 12 random cases where self-neglect is involved, and we asked people to basically rag rate themselves and give us all the information about their work within that case. We did one in 2018. It wasn't good. That's why we're doing it again, because what came out of there were things which really needed to be worked on. So we decided, let's do another one, and then we can have a comparison between the two audits, but then run a conference, which will be a challenge event as well to those services. We're working with the BME Forum. We're really desperate to get engagement. Our data across the partnership tells us that referrals, safeguarding adult reviews, concerns don't tend to come in from the BME community. So we want to know why. Who are we not reaching, and why are we not going out there and reaching all communities? And it's a really key priority for us to take this forward. So we're working closely with the BME Forum and other networks. So if anybody's got any other suggestions for networks or forums, then please let me know. I mentioned to you already about the safeguarding reviews and how many we're about to publish. And the monitoring of SAR recommendations, I touched on that slightly earlier on, but to me, that's really key to our work. If we're not going to get this learning from these, they're expensive to run a safeguarding adult review. We have to have an independent author in, and we need to make use of it and take the work forward. Do you want to go to the next slide? Basically, how to contact us. I try to get back to people who send me emails. That's the email addresses. We have a generic box, the csab@croydon.gov.uk, which only myself and Leslie have access to. And people seem to sort of find that box. I don't know where they get that information from, but we tend to be a bit of a signposting box, but we're happy to do that because it kind of keeps us in touch with what's going on across the partnership. And that's our website. So, there's no locked pages on there. It's open to the public. So please just sort of go on there and have a look and see what you can. If you need to sort of contact me just about any of the pages, any suggestions, happy to put links to this forum on there. So just send me anything and I'm happy to add it to the website. It's only been going a couple of years, this new one. And I think have I got one more slide? Oh, important, thank you. And any questions, and that's kind of a whistle-stop tour of some of the stuff we do. Any questions? I don't know how you want to handle this, Peter.
Peter, I think anyone can ask a question by raising their hand or by put a question in the chat. One thing I will say, and thanks for that, Denise, is that safeguarding is more than just what happens on the ground level. It can work for communities. It goes far beyond that, as you've seen. It's touching on those from different cultures. We're looking at things like LPS. It really covers a wide range, and people almost think that safeguarding is a victimization against themselves and their own service. And I think the understanding of this, we're trying to help better all the service that we provide, and for the people and for our loved ones and the people we care for. And using and looking at what Denise has shown is been really great. To add to other things, at the bottom, we've put in things now like captions, so those who are hard of hearing can now actually maybe read some of what's going on in this meeting as well. So we're trying to look not just different language barriers, but all ways of working to help improve the such diverse workforce that we have in social care. So really looking at things which can help bridge the gap, communities. We know ICS is coming forward, really trying to help and put your input in. If you need to, sending in any information to Denise, if you can't have or can't think of anything now, please by all means get in contact with myself or Peter or Denise. And even though Denise is Croydon based, this reaches out to all the other communities, boroughs that we work with, and it's the same mindset that we really want people to have. Other than that, Peter, lead the way. If any questions are in the chat or anyone wants to ask a question, please do.
And that's a key point, Dudley. It's, although I'm the board manager in Croydon, I have a network with all the board managers across London, plus a national one. So there's lots of work we tend to do across London to try and make it consistent. So we're kind of working, at the moment, we're working on a safeguarding adult review regional protocol and policy, so that it's the same across, because we all do it kind of the same, but different. And I think Peter mentioned something in the email to me about the Pan-London policies and procedures, the London ADAS ones. And, you know, we should all be working to those, but there are always some tweaks and slight changes, which I think is the way, that's the way the document was written, so that you can add your different appendices on the back. But there is also this standard data sharing agreement across London. So when I hear people saying we can't do that because we can't share information, they're all signed up to it. All partners are signed up to this data sharing agreement. So that they shouldn't, you know, I know what we're all saying, that people seem to do them, take the Pan London differently, but really with safeguarding, it should still all be the same, if that makes sense.
Yeah. We
just might do it differently in tweaks because of the councils.
Good safeguarding is good safeguarding.
I absolutely agree with you. And it's about, it's, you know, and people get confused. I'm glad Dudley said that. The word safeguarding, and this is why we're really keen to get these citizen-led resources out. The word safeguarding isn't liked by lots of people in the community. We've been using examples from the Leeds Safeguarding Adult Board, and they've shared all their resources with us, and they're absolutely brilliant. And they don't use the word safeguarding, they just say keeping people safe. And I actually think that's so we've developed this generic this presentation to go out to all the different networks and forums called Keeping People Safe. And I think that's really key, because people think of safeguarding as something then services are involved in. It's not a positive thing, it's a negative term, but it's not, you know, we need to kind of get rid of that stigma around the word safeguarding. We do lots of other stuff which are helpful and enjoyable, rather than it all comes down to bad things.
And it has to be remembered that we are dealing with individuals rather than just simply groups of people.
Absolutely.
And this is often the criticism of, if you like, the overarching system, not just of safeguarding, but of local authorities, of CQC. It takes out the individual. The individual needs to be brought back into the focus, the core of their care.
Yeah.
And sometimes issues that may or may not turn into safeguarding are simply because that individual and their needs have been perhaps overridden or ignored for what might be seen as the good of the group of people that are being looked after. And there are, I would guess, some providers who simply have little understanding of what keeping people safe or safeguarding actually mean. Yeah.
And I agree with you about the individual, and that's something, you know, in the board priorities, well, one of the main ones is making safeguarding personal, and it's about the individual being at the center of all of this. And that's definitely our policy as a board. You know, it is about the individual, and that's definitely the case when we're doing the safeguarding adult reviews. Kind of, what if this was your mum? What if this was your daughter? You know, which you need to keep at the forefront of your head when you're actually doing those types of reviews.
Yeah. Questions. A very useful opportunity for you to actually question a safeguarding lead here. Who would like to go first?
So that's wonderful word of safeguarding. Everyone is a bit safeguarding themselves with what to say. I really like the scenarios that you put up there, Denise. I think people always think of their own victimization, own scenarios, or very scared because they feel staff can use it against them and their organization that they work in. But I think if you think of the scenarios that we're looking at individually, we're trying to improve not just what's happened, but better working going forward. So we all make mistakes, as we understand. It's what we learn from the mistakes and how to do them better. And I think that's one thing that maybe the pandemic has brought around, that we're joining together to actually see what good looks like. We all want to know what it looks like and how it can be achieved, but alone by just scenarios or what could be done better as all together as a sector, I think it's really important and key. And even though we're trying to change the narrative around safeguarding, if you look about, as you said, what can we do to enable to keep our services to be better and better places and individuals to really get the sort of service they deserve. And I think then maybe then we may have a better understanding of raising questions and scenarios, which will be very helpful. So thank you very much for that, Denise.
And one final thing, can I just say, the safeguarding adult reviews, although there's obviously work we need to improve on, there's also really good practice which comes out of these reviews. And, you know, you can pull that out and say, you know, this worked really well, and this is how we want it to work. So people tend to think of it as everything is going to be a criticism of a service. That the reviews are all about non-blame. It's about that opportunity to improve services, but don't forget there's really good practice out there, and there's really good practice which shows up in all of our reviews.
And I think that's incredibly true. And one of the things that I pick up with when I talk to providers is actually the very poor levels of training that are provided in key areas such as safeguarding. And when we look, if Dudley or myself or somebody else looks at a situation, we then go back to how are these people trained? What did they actually know? If they didn't know what they were supposed to do, how can, as you know, as managers, as an organization, expect them to do it correctly? And it needs regular reinforcing. And you know, people frequently forget some of the items because they're under tremendous pressure, particularly over the past couple of years. And
absolutely, you know,
you're all subject to CQC inspections, and they are not taking any prisoners at the moment. They're going back to a very tough regime.
Indeed. Peter, I think we've got a question from Saad. If yep. Saad, by all means, please unmute and ask your question.
Yes, please. Can you hear me?
We can.
Yes, please. And my name is Saad Usman. I'm from Dignity Direct Home Care. And we mainly work with Greenwich and Bromley. And from my experience, and we've been doing care like 7 years now, we also, and statistically, the most safeguarding we have is pressure sore, pressure and ulcer. And the problem is, and we have done a lot of training, we spend a lot of resources in that area. So first of all, I like the next conference or whenever possible, and we should cover safeguarding on pressure sores. It's very important because that area is, and I would say 80% of our safeguarding for the last 6 years is pressure sore. And I give you an example. And for example, there's a pressure sore or redness, you see a client and bedbound normally, and then you report that to the district nurse and the council. And next month, the client has been admitted to hospital, and maybe the hospital don't, and they don't give a lot of time, or whatever happens, the pressure sore has increased from level 1 to 2. And then when she comes out or discharged, or he comes out, then the pressure, and they raise safeguarding again. So it's always pressure sore issues between the hospital discharge team and the agencies. That's happening very often. Another thing is, and carers are not reporting the redness, and because sometimes they see a little redness, so they take it lightly, I've noticed that, but we addressed that issue by doing more and more training. Even yesterday, we're doing a lecture in Sadak. So we spend a lot of time on pressure sore. And I wonder, what's your point on that one? And can you accommodate one? And because it's really too much. I would say 80% again of our safeguarding for the last 6 years comes from that area.
Right. Well, thank you for the question. I think, did you say you're from Greenwich? So I can tell you what we're doing in Croydon. We have one of our working groups is a health task and finish group. So when we start seeing sort of changes, so maybe more pressure ulcers coming through on some of our committees, we kind of look at what we've got out there in policy and training. So we are currently revising our pressure ulcer policy and our flow chart, which the one we're using at the moment is on our website. We put all our resources on the website, but we're currently updating it. In fact, I have the papers here to actually sign off and go through the final copies. And then it's about the training. I'm not sure what other boroughs do and SAB areas do, but in Croydon, we have a really good committee called the Intelligence Sharing Group. It's on the structure chart, so you'll see it. It sits under performance, and it's something we come together every 6 weeks, looking at the provider market. We've got CQC on it, we've got health, district nurses, infection control, you name it, they're on this group. It's a really proactive group. So if there were cases coming through around pressure ulcers, we've got rapid response on there. We've got, as I said, the district nurses. They can go out and do training. They will contact the provider and say, you know, this has come through to us. Do you want some help with this training? And we add the care support team. So I don't know if some of you have already had contacts with Darsan in rapid response, or our care support team. Alison Strang is one of them, and Dan. So, you know, we try and do as much work as we possibly can, but it is about the training. And again, with our kind of structure, we want all our groups to link together. So if we have issues coming, like you've raised this today, I will go back and see what the situation is with pressure ulcers, and we link to our training group. So if there are gaps in the training, as a board, we put funding aside, but it has to be for multi-agency training, and that's open to everybody across Croydon. Okay, so you know that's there. It's not just adult social care do their own, health do their own, and police, etc. But if we do courses funded by the board, it's open to everyone. And I think you need to be, you know, and that kind of information is also on the website, and we're about to update that with some more courses. So we're hoping to, like Peter said about understanding about training, and we can't expect people to do their jobs if they're not being provided with the right training. We're looking at courses around professional curiosity, because that's a thing which is coming through our SARS, like, oh yeah, we saw that, but didn't ask those questions. And that's kind of what safeguarding is about. It's not just what's presented in front of you, it's all those other things.
I think professional curiosity is a brilliant expression, and I think it leads very firmly and straight into organizational culture. If staff have the ability and they feel confident in saying, well, I don't really understand this, or I don't know that, that is a brilliant situation. I mean, if they're asking the same question every day, well, maybe not.
Yeah.
But if they're asking new things, that's a really useful lead for training and for staff development.
Absolutely.
And training staff properly is a key part of retaining your staff. And I think, Sard, you've raised a very useful point. I mean, pressure sores or pressure ulcers seem to have been around forever, and it has got better over the years. But I think I'm correct in saying that Bromley still provides some training, but I would contact them. And I'm not sure about Greenwich, but you know, by all means contact them. And if you find out something, then bring it back to either Dudley or myself, because we can circulate it, and pass it on to other providers. What we sometimes hear from providers, from training providers who work with, say, local authorities, is that they have options available, but people are not using them.
Yeah.
I mean, I definitely agree with everything that's been said. I think I love what you said, Denise, about joined up thinking and training. I think there is lots of training that's been made available. Really do go to your borough leads and councils and really look, if not on the website, ask what's available, because it's something that they should be providing for the whole group or your patch or wherever you're based. And Denise has given you just an example of Croydon of what's being proactive that they're doing, but most boroughs should be doing something. So if they're not, please do let us know, and we'll try and raise the point with potentially those in the borough as well. Thanks for that, Saad.
And I know when our commissioning colleagues and team go out to providers, if there's a gap with training and they sort of say this to the colleagues, they bring that back to the training group and this intelligence sharing group and say, look, that they really would like this training. So that's another link in with commissioners and the contract monitors to sort of say, but we need to do that, we need this. Training's key. It comes up all the time, doesn't it, through not just safeguarding. We have to get it right. And I'm not keen as the budget holder for the board to say, yeah, let's do this training. But if that's not the training which is needed, I don't particularly want to fund it. I'd sooner be putting training courses out there which we need.
And I think, we look at organisations, and I appreciate that many organisations are working on very low fee levels. There's very low margins, but they're all spending money on training. And if you're spending or wasting your money on poor quality training, then you might as well just throw the money out of the window. Getting good quality training is absolutely essential. If local authorities or the NHS offer you training, I have to say I've found that universally to be good quality. They use good trainers. There are good trainers out there available to you. To be honest, we're looking at working with one or two training providers at the moment who cover those areas. Many of you will know John Buttle and his colleagues at Social Works. John can't be with us today because he's got a toothache and has had to get an emergency dental appointment, which is unfortunate, and rather him than me. But training needs to be done properly, or frankly, you might as well not do it at all. And CQC and local authority quality monitoring teams will pick up areas like safeguarding very easily. And I think Laura's just made a good point. Yeah. And there's some good training available, good points available, some of which is free. Unfortunately, I have to say it, some things that are free don't seem to have any value to people, so they don't use them. And then they complain about the price of getting something elsewhere. But training is absolutely vital. If there are any other points for Denise, or if not, then we'll move on to Laura. Thank you very much, Denise.
Thank you very much for that, Denise.
Can I go?
You need
I think it's safe to go, Denise, now.
Honestly, please email me though if anybody's got anything. My details are on the slide. So thank you, everybody.
Thank you very much, Denise.
Thank you.
Thank you.
Laura, I'll put your slides up.
Thank you. Thanks, Peter. If you go on to slide 2.
Hang on, I'm just trying to get, I can, hang on, it's just wants to go back to, problem is, Dudley, I can't get to the stop the share because the closed captioning box is in the way and it won't let me through it. You're on mute, Dudley.
I can hear you. Is it gone now?
No.
Okay, that's probably for me and mine. 1 second, I'll do that.
hang on, right, okay, let's. Right. Can you see those? Have you got a full screen?
Yeah,
I've got
Peter.
the screen, I can read the text, okay.
Okay. I can't get to the controls, Dudley, because of the
Let me remove that then. I'll have to go into the settings. Whilst you're doing it, I'm not sure if Laura can read some of it, and we'll try and make it bigger at some point. Give me a second.
Yep, I'll make a start. So
okay, thanks, Laura.
The theme of safeguarding. So some of you may already know that Skills for Care has developed a good and outstanding care guide. And this guide covers all of the CQC's key lines of inquiry. And for each key line of inquiry, it's a massive document, there's just some guidance about what you need to be doing to achieve either a good rating or an outstanding rating. And there's some practical examples in the guide, just showing what good and outstanding rating providers are doing to achieve their rating and maintain their rating. And there's also some information about what to avoid as well. So just some examples of practice that may lead to a rating requires improvement or inadequate. So what I've done is pull some information out of this guide about safeguarding. And on the slide, I've listed some recommendations from providers who do have good or outstanding CQC ratings about what they're doing and about what they've advised other organisations to do as well. So as we've spoken about, the first thing I wanted to say was how important safeguarding training is. So have staff receive training that's relevant to your service and relevant to your client group. And importantly, I think, as Dudley said in the chat, it's not a tick box exercise. Are you regularly checking people's understanding that they're actually putting this learning into practice? And as well, are you including safeguarding discussions in supervisions and team meetings? Something you could do, and something the CQC really likes, is developing staff as safeguarding champions. So it's a really good development opportunity for a member of your staff. And their role will be to be a specialist in the area of safeguarding. So they'll be responsible for researching best practice, sharing this at team meetings perhaps, and also providing advice and support to colleagues. So that could be a really good option. We're seeing that some services are developing films of various safeguarding scenarios acted out by staff. And these are used during training sessions and team meetings, just for staff to discuss. And it really helps them learn how to recognise potential abuse and how to then report that. A key one as well is making sure that the people you support and their family and friends know how to report poor practice without any recrimination. So do you have a whistleblowing policy in place? And if you do, are people aware of it? Or is it just sitting on a shelf somewhere? So you could add it to your website if you have one, or maybe a client welcome pack if that's something you provide. And some services as well are actually creating keeping safe packs for the people that they support. And these provide information in pictorial, easy read and sign and also written formats about what keeping safe means, the different types of abuse, and also how to raise concerns if they have any. So care plans, we do see that a recurring theme in the reports of providers that requires improvement or an inadequate rating is that care plans can be very generic rather than focusing on the individual and their needs. So make sure you've got a good understanding of what makes people feel safe, and always make a note of this in their care plan. And we've touched on culture as well, so just making sure you haven't got a blame culture, that everybody's too scared to report incidents because they think it could result in them losing their job or being disciplined. Make sure instead that staff are empowered and supported to raise concerns, because otherwise it will take quite a while before things come to light, which is just going to make the situation worse. And also make it really clear to staff and the people you support that anything that's raised is going to be taken seriously and fully investigated. So if you go on to the next one, please, Peter. And just some more recommendations from the guide. So obviously investigate any safeguarding incidents as soon as possible. carry out reviews just to see if there's any trends that you can identify, which may help you kind of decide what actions to put in place as a result. Always communicate follow-up actions. The CQC wants to see that managers have shared learning with staff about any changes that have been made as a result of investigations, and also record any decisions about how the organisation is going to minimise the chance of reoccurrence. So whenever we talk about meeting CQC requirements, we always highlight the importance of providing as much evidence as you can about what you've been doing. So when that comes to safeguarding, this is going to be documents like risk assessments, care plans, evidence of staff training and supervision. So when you have had a safeguarding incident, make sure you record what you're putting in place to stop something similar happening again, and highlight as well how the learning from the incident is going to be used. And as a registered manager, you need to make sure your knowledge is kept up to date as well, not just the knowledge of your staff. So coming along to networks like this is really helpful. Skills for Care, it's got a digital module for managers on safeguarding, which I'll give you the link to in a moment as well. And our Good and Outstanding Care Guide, the link's at the bottom of the slide. So when you get access to these, just click on the hyperlink and you'll be taken to it. There's a lot more information in there about safeguarding. This is just a kind of a quick overview. Okay, next slide, please, Peter. And these are the safeguarding resources that you can access in Skills for Care. So firstly, we've got a guide to adult safeguarding. So there's information in here about what CQC inspectors will be looking for, a bit about the work of local safeguarding adults boards, how to make sure that everybody knows how to identify and report a safeguarding incident. So really expanding some of the things I've just spoken about. And the digital module I mentioned. So we've created 11 digital modules for managers, and there's one specifically on safeguarding, protection and risk. So each of these digital modules will cost you £10 to buy, or you can buy all 11 of them for £75, but you can actually claim funding back from the Workforce Development Fund for these. So you can claim back £50 per module, even though they only cost £10 to buy. And the idea is that this money also covers your time spent completing the module. They're probably about 30, 45 minutes long, I'd say. And also the time taken to apply and embed the learning within your organisation. So worth looking into. You do say pay out initially, you can claim the funding back and more, taking your time into account. And hopefully everybody knows about the Workforce Development Fund already, but let me know if not, and I can send you details. And as I put in the chat earlier, Skills for Care endorses learning providers. So they go through quite a rigorous quality assurance process. And once we're happy that they can provide high quality training, we add them to a database on our website. And in the chat, I've put a link to a list of all the providers in London that can offer safeguarding courses. So a way of avoiding paying out for poor quality training, do use the provider on our list. Next slide, please, Peter. So the final thing I wanted to let you know about today is the new Skills for Care website, which launched last week. And I know it wasn't always easy to find things on the old website. This new version, I think, is a lot clearer and laid out a lot better. So it should hopefully be simpler to find what you're looking for. So you'll see on the screenshot on the slide, there's sections on funding, which includes information about the Workforce Development Fund. There's support for leaders and managers. And in there, you can find information about the digital modules I've just spoken about. There's lots we have on support around recruitment and retention, developing your workforce as well. So that's information about qualifications, short courses, other ways of developing your staff. Lots of useful information and resources, so guides, videos and case studies. Anything you can't find that you're looking for, just let me know and I can signpost you. And the web address is still the same, just at the bottom of the slide there. And just a final slide, as always, our contact details. So I'm the locality manager for South West London, Selena for North West London. Please do get in touch with either of us with any queries about recruitment retention, workforce development funding, and the wide range of other things as well. Thank you.
Thank you, Laura. Any questions for Laura? You're on mute, Dudley.
I've got a point to raise. There's lots of training available and lots of resources, as Laura has said, about skills for care, and lots of people have been too busy or just carry on with their day-to-day lives. The website is a lot better to manage and maneuver, but also as well, Laura mentioned the point on the WDF, which is funding available for you as employers or providers for your workforce. And as a result of that, you are able to claim that money back. What Peter and I are trying to do is that one of the things that we get a lot of feedback from is that people, A, don't know how to fill out the form or the time it takes. And we are probably going to be putting together, in correlation with John Buttle, a masterclass on how to fill out the form for those who are probably unsure and don't want to take the plunge. And we'll be making that available for that to happen. So please, by all means, look out for the dates. We will help you with that. And then all the wonderful opportunities and training available with Skills for Care, you should be able to access, or at least apply for funding to go with.
I was about to put the detail. I can't get to the stop share box, Dudley. This is a problem. And I was going to put the details of the WDF event up.
Right. Let me do that. You want me to remove the captions, I'm sure, right?
Yeah, please.
Let me do that.
So there must be a way of putting this somewhere differently on the screen, but
yeah. Let me see if I can do that. If anyone wants to ask any questions, I know we can't see. I mean, I can do my on the side on the screen view. I can do my gallery view. By all means, anyone can raise a hand if they want to ask Laura any questions about the website or anything that's happening. Please, by all means, please do. Let me try and...
thanks, that's it. Okie dokie, great stuff. Thank you, Dudley. Right, sorry, I've missed that. Are there any questions for Laura? Or any points? Laura, are any key areas on the New Skills for Care website that people ought to be focusing on?
Support for leaders and managers, as we do a lot for registered managers. So we've got our membership, and we've got advice line, we've got kind of digital modules and lots of other learning programs as well that you can access. So definitely, if you've kind of limited time, it's probably the area to prioritise. And lots of webinars as well, actually, we run on a range of different topics, which have all been recorded and available for you to view at any time. Just kind of short, half an hour. I think they may be on a safeguarding, actually. So yeah, do have a look at those.
Okay, great. Thanks, Laura. I'm just putting... I've just put the details in the chat of the meeting later in February. I think it's the 10th. Yep, 10th, to explore WDF, how to access it, etc., etc.
So anyone who's not sure of how to do it and fill out the form, some people have been sort of scared off in the past, and you can sit through there, ask any questions, and go through a sort of masterclass on filling out the form, yep, so that you enable you to access the funding that you should be able to get.
Okay, great stuff. Thank you, Laura. We've got a couple of presenters, and happily we've got Paul Harper with us again, and we'll go into that shortly. But just before that, we've got Scott from Purple Tribe with us, and he's just going to do a short piece just to remind people and give you some very useful points about recruitment and retention. Scott, the field is yours.
Hi, Peter. Thanks ever so much for that. And that was really insightful, Laura. I think we'll be probably in touch ourselves with you about what's available for Skills for Care. That dovetails quite nicely into what we're looking at doing. So Peter, Dudley, thanks for inviting me on again. Yes, just a quick 5 minutes overview, which is a lot to get to on the subject of recruitment and retention. Just a quick heads up, if you are in the London Borough of Havering, you'll have the benefit of getting our services free of charge. We've just had the sign off today for the Workforce Recruitment and Retention Fund project that we'll be rolling out across the London Borough of Havering. We are also waiting to hear from Bexley and Bromley on the same sort of project. So, I'm sure Peter and Dudley will keep you posted as that rolls out. But yeah, quickly moving on. Peter's asked me to look at recruitment and retention, and what I wanted to do, I'll just quickly share my screen with you. Not really death by pound, just literally 2 slides. So, as I mentioned, my name is Scott Sherriden. I'm the Managing Director of Purple Tribe. We're a recruitment process outsourcing organisation specialising only in adult social care. What I've been asked to look at today is what's really been working for us from a recruitment attraction perspective. The stuff that, like I said, I'm going to chat with you about, this is the same methodology we use for our outsourcing. It's also the same method we'll be using to deliver recruitment services for best part of 90 care providers across the London Borough of Havering. So that covers domiciliary care. Just to be clear, if you're on the framework for London Borough of Havering, or you're a member of the Havering Care Association, you will get access to our recruitment services. So with regards to what's working, the landscape has changed right now with regards to recruitment and retention. Traditional models of which most providers, especially in domiciliary care, are only using the career site Indeed. We'll have seen candidate applications plummet, probably applications drying up, but maybe costs significantly increasing. We as a provider have, the best way to look at it is like trying to back every horse at the moment, and you cannot afford to not back one. Google Jobs will be now the dominant factor coming forward onto the market. It ranks #1 above all other services. You will see on any job, whether you're looking for a cleaner, a teacher, when you type in healthcare assistant jobs, say Twickenham, you'll probably see 1 or 2 Google sponsors ads. These will change based on your location. Straight after that will become Google Jobs, advertising 40, 50, 60 Google Jobs straight in there. What people need to understand about Google Jobs is this is not a source like an Indeed career site where you can simply post your job to. It requires you to have SEO optimized career pages and web traffic, because right now it is what you call scraping jobs from other sources. And what you will find, people were finding their vacancies on Google Jobs. And we did a test with Hours of the Week where we'd seen a job that was advertised. We've asked for it to be removed by the scraper. But what these job boards do is they scrape jobs from other sites in order to collect your data. So you'd see, say, a care job in, say, Wandsworth. You click on the job, it then goes to JobSwipe, asks you to fill in your email address. Then JobSwipe may take you to Top Bananas job board, asks you to fill in your details. Probably eventually turning up at possibly something like Total Jobs or CV Library. By this time, you've probably got candidates that may have dropped out of the recruitment process. So Google Jobs will be a dominant factor. Indeed is going to move very quickly to what you call a pay-per applicant process. So you, rather than playing a pay-per-click model, which people are not very best pleased at now, pay-per applicant is coming in within the very short term. And for those that are sort of a bit concerned about Indeed, it's also opened up Indeed Flex, which is also going to be a bit like, for want of a better word, an agency, offering care workers, offering temp to perm work. So in a way, Indeed's going to be potentially competing in the sector. Right now, we're finding that between 65 and 72% of all our clients' recruitment candidate applications are from non-Indeed sources, which is it's an entirely about face from where we were 18 months ago. It would have been 75% Indeed, 25% other sources. So it's been a real turnaround. The only job board that's featured on here that we don't use, by the way, we've dropped Monster from our job board group. because we don't see the value in that board anymore. But the top boards for us, Total Jobs, CV Library, read.co.uk, as well as we use a lot of free job boards like Glassdoor, Everyday's Different Campaign, Job Centre Plus. The other one is digital campaigns for Facebook. That is another big campaign. Now that is very different to Facebook jobs, but ultimately speaking, it's about getting campaigns based on demographics, because you use what you call a bit like artificial intelligence to sort of find the right people with the right match for your sort of careers. So there isn't a one cap fits all for providers out there. It is going to get a little bit more difficult for providers to attract staff over the coming 6 to 12 months because of the simple facts that we've had people, so 1.4 million people leave the UK, 700,000 of those are from London, so 8% of the working population. We've gone from 3 million to 6 million people on universal credit, as well as we've gone from 300,000 open vacancies across the UK to over 1.1 million open vacancies now. You know, you see Amazon sponsoring jobs, etc. So it is tough out there. So that's what's been working from a recruitment perspective. The 3 tips that we always give people are widening the talent funnel, so finding places that you've got to attract candidates into that. So again, you want to be on paid job boards, free job boards. Google Jobs is free, your applications will be free, it will be for the foreseeable future, and using Facebook, but we prefer digital campaigns as opposed to Facebook jobs. The other critical things are not only down to your process, so speed of response. In our world, we have a service level agreement. We'll contact all candidates, regardless of their CV or what their profile looks like, to have a conversation with them to establish whether they've got the right values, the right beliefs, and fit for your business. And it's critical that you respond to candidates. And we would expect you to ring candidates 2 to 3 times, 2 to 3 emails and texts. And again, making sure your interview availability is within 24 to 48 hours. We estimate within every 24 hours you lose, you probably have a 50% less chance of getting in contact with that candidate. Recruitment metrics is the other thing as well. You can't improve what you don't measure. Data is king. We always talk about it. So you want to make sure that the things you're measuring, where am I advertising my jobs? How much are we paying for our recruitment advertising versus the applicants that we get? The cost per candidate acquisition, interview invite to no-shows, and then conversion rates from interview offer to interview accepted. And again, throughout that process, if you measure how long it takes you to do those things, you can tighten up on that. I'm conscious I've only got 5 minutes, so if anybody wants to get in touch, people no doubt send the information out at Purple Tribe. There are some useful tips on our website, some ebooks and some case studies on there that you're welcome to download. And you're welcome to sign up to PT Tips, which gives you sort of fortnightly recruitment best practice tips on ideas on how to recruit. And via the LCaS website, we'll be hopefully doing some best practice webinars on recruitment interviewing and stuff like that. So 60 seconds over. Sorry, Peter, I've got to squeeze it as quick as I can for you there. Rapid fire, just as you asked, boss.
Right.
Thanks, that Scott. I'm glad you didn't do the Captain Birdseye lookalike at the beginning as well. But no, thanks for that. I think it's really important at a time now with shortages of staff and all of us trying to get an extra edge of not just recruitment, but retention. This really plays a part. And do have a look at some of the stuff that Purple Tribe are doing. It's not just for London, it's nationally, and they've really been taken on from various different councils and boroughs. I think Scott may put his information in the chat box of really looking at his tips and tricks, which are really easy to use and look at, and may save you maybe a lot of money that you may be spilling out to a lot of these agencies that you may be looking out for as well. So thanks for that, Scott. It's been really helpful.
Thanks very much, Scott. I mean, I would just make the point that you as managers can't be the experts at everything. You know, you hand over many things at the moment to outsource them, HR, health and safety, things like that. Recruitment and retention is a very time-consuming part of your work, and using experts does give you a better response. And, you know, Purple Tribe has shown some very good results. And we'll send the information out that Scott has provided. And, you know, we keep updating that via WhatsApp and through the website as well. So thank you, Scott. Without further ado, Paul, can I put your slides up? Some really useful stuff there. Brilliant.
Thank you very much. And I'll just take 5 minutes to go through some key digital messages. And whilst I am from Southwest London, some of these opportunities are absolutely available to all of you. So Lovely. Okay, next slide, please, Peter. It's really just to plug Digital Social Care. And if you aren't already signed up to their newsletter, I'd suggest you do. There's some really, really useful digital content here. This slide talks about training and the output of a digital skills review that took place last year, which basically concluded that social care workers are very keen to develop their digital skills, including older people. By older, it says over 55. It's not particularly older, but that group is absolutely keen to develop its digital skills. So really good links to free training. Click on that link around cybersecurity, guidance for staff, DSPT, and other matters. Whilst we're talking about training, can I also plug Barclays Digital Wings, Digital Eagles? Again, if you look at the Digital Wings site, there's lots of free training here available. Might be around essential skills, getting started with the internet, keeping safe online, and many other topics. So if you're looking for some really good free training, try Digital Wings. Now, Barclays Digital Eagles will come in and run sessions for individual homes or groups. We'll pick up on topics, so a really useful resource. So this, okay, I'm South West London, and this is a South West London resource, which is particularly around DSPT, and they're highlighted the key lines of inquiry with CQC. So if you happen to be within South West London and you want some support with DSPT, then the SWL Care Homes .admin address are the people that you should contact. They can absolutely take you through from first principles. Get in touch, and we're sort of here to help. Absolutely. Next slide, please, Peter. This is support that's available across London now through London region, if you like. So webinars that are currently taking place twice a week, led by Sarah and Tyler, which cover DSPT, but also a range of other digital topics. Now, I attended the session last Thursday. I think there are probably about 15 homes and a couple of domiciliary services attending with questions and issues largely around DSPT, but other digital matters as well. So do give it a go, bookable. I think if people use these sessions, they may well extend them. So if we don't, there's a risk they'll be lost. But yeah, do give those links a try. We'll share the slides afterwards, so you've got those links. If I can plug also on digital social care, this really is a 4-minute animation that explains the essence of DSPT. 4 minutes of your time, I think, will be really well spent. So yeah, activate that link, take a look. It just goes through the main principles of DSPT. It's a fairly new animation, only been out a couple of weeks or so, but yeah, do give it a go. Rattling through these slides, the Digitizing Social Care Records, just a reminder around NHSX's accredited supplier list. Each of these solutions is accredited with the NHSX. If you click on each, there's a really handy, I think it's about a 15-minute video, which kind of outlines how these systems work, how these applications can be beneficial to you. I think mainly in a care home setting, but some are also relevant to domiciliary and other settings. So do give it a go. Accessible through the Digital Social Care website. And also there's a masterclass session which you may well be aware of. Some of these sessions have passed, but video recordings are available. And there's still sort of February, March's sessions to view. So really about the essence of digitizing social care records, how to do it, mobilization, involvement of your workforce, contract management, etc. So a very useful resource. You have to book early. It's no use booking sort of a day before, book a week before, because they very rapidly get taken up. And finally, this is a bit different. I just wanted to promote the Care Home Pioneers Leadership Programme. Now, this is available across South London for care home managers. I'm not sure whether there's something similar in other parts of London, but this is a a program there to build resilience, it's a valuable training session for care home managers to develop a range of skills. I think it takes place over a 9-month period. It is free, so take a look. It's delivered by the HIN, and yeah, really valuable resource there, which we're keen to promote. The closing date for that, I think, is the end of this month. So if you are interested, do get in as soon as you can. And that's it from me, Peter. Just some key messages. I've probably overrun, but happy for those slides to be shared. And if anybody has any issues, please feel free to get back to me. I can at least point you in the right direction.
I mean, thank you, Paul. That's very useful. And you will have heard in the last 2 presentations, the word data keeps arising. So as social care providers, you can no longer simply bury your head in the sand and ignore things like DSPT. You need to do it. It's pretty much an essential. And things like digital wings are very useful. And we will have, a further session from Paul at the March session. I think it's March the 16th with more detail. So if I could get rid of this screen, I would, Dudley, but
I will do. I want to share something right at the moment. There's a lot going on with digitalization as well as social media as well. I just want to see if we've got a minute to be able to play something very quickly, Peter. If anyone, let's see if this can work.
Slow down,
He knows where he's going. Oh, baby! Oh, my little baby boy! Oh, my love! Oh, I love you!
You're having a fantastic time, aren't you? Having a laugh. I want a fantastic scenery.
Oh, for God's
Got everybody giggling? But I'm blocked up at the moment with this cold. Still not got rid of it. Not a good It's different things. We're not talking about your cold, what it's made out to be, is it? No. It's all fun and games. Anyway, we're all ready when I've had to take a week. I've watched you.
So the reason why I shared the video was because it shows that social media can play a big part in what we're doing. And now what you've seen is the video I showed you was from a care home called Red Bulls, who have got over 1.5 million worth of subscribers on social media TikTok platform. And for this in itself is shown the importance of social media can also help and attract various people to your service as well. And also the importance that it can play in the workplace, helping people share stories and families connect with their loved ones as well. So to use digitalization can really play a big part in all of our work settings. And that's why I showed this video. So thanks for that, Peter. And I hope I can remove it from my screen.
No problem. We've covered an awful lot today, a bit of a whistle-stop tour around various things. As I say, the slides and the recording will be on the website, fairly swiftly. I've just posted, I've partly posted on something. There's a free webinar around the health and safety executives' ongoing Working Minds campaign. They're actually checking on social care organisations at the moment, so that's worth looking at. I've also had a piece of information this morning, which will be more relevant, I think, to those of you as DCAs or learning disability, supported living, who are registered with CQC as a DCA. Some time ago, the local authority group commissioned a consultancy body to develop a home care cost of care toolkit. Now, we've actually seen this demonstrated some time ago, and it has, as of today, been added to their website, and it's in the public domain. there is a tool, there is guidance. I have copies of them, which I will put onto the website and circulate later on today with a bit of luck. Now, local authorities don't necessarily have to use them, but some of them are also using one by an organisation called IESE, I think. We've also got copies of that if you're interested. But the one that's been developed by ARCC has a slightly different approach, and it's very useful for you to work out your own costs. And it does actually have a check system within it. And that covers areas such as training and how your expenses are going. And if you need basically to be adding the right figures in there, or it will pull you up, because local authorities quite rightly are becoming concerned that, say, the budget for training is not being properly used, or the budget for pensions, etc., is not correct. So that's something that you can also use as a bit of an audit tool. As I say, that will be on the website for you later on today. There are a few things in the chat. We will post a pile of stuff, and I will take up that HCA issue that's been raised. Thank you very much. The next event, the next RM meeting, is on March the 2nd, and that's around importing social care workers or migrant workers. And we have Fraganet coming to that one. They are the people that have been working, I believe, with Skills for Care and also with the department. If you have questions, do let us have those questions in advance. It will save time. But there is a lot of expertise there. And also, Dudley, I think, has just posted a message about WhatsApp. If you want to join WhatsApp, please let us know your mobile number and the areas that you work in. Any points from you, Dudley, or again from Laura?
Very quickly, with the event coming up next, there is lots of information that's happening. I believe the Home Office said they're going to go live with overseas workforce from the 15th of February. So there is a lot around the area of sponsorship licenses. There are 2 events that Laura also posted earlier, but they seem to be filled so quickly. But by all means, we're also going to put an event on where questions can be asked, and we also may have some further information from someone who's gone through the system as well, and maybe also to ask any questions on the day. Thanks.
And I think that, you know, I have talked to a number of people about importing staff, and they seem to think that this is the be all and end all. It isn't. It's a very expensive process, and you may well be better advised to spend your money on a recruitment system here. But that's up to you. But if you do whichever way you do it properly and invest your money wisely. Any points from anybody? Any last things, Dudley?
I know there's so many changes. We've got the 3rd is meant to be the day where the first mandatory vaccination of the VCOD2 is meant to take place, the first dose, should we say. I'm sure we all are aware that so much has changed at the moment. So please keep your ears and eyes to the ground and the news of what's going on. We will try and share as much information as we can as it gets updated. But the way it seems at the moment, it seems that there is going to be a full U-turn. So just be mindful of whatever you're doing within your workplace at the moment, especially for those not in the NHS. Not the care homes have obviously gone through it, but only other sort of specialities within health and social care. Please be mindful and be aware.
Okie dokie. If there's nothing else, we'll wrap it up at this point, and we look forward to seeing you at the next meeting, and we'll circulate all the information and we'll be in touch. Many thanks.
Take care, everyone.
Cheers.
Bye.
Bye.
Thank you. Bye, everyone.